My name is Pattee. I've been practicing here in Wisconsin for 7 years. I moved here from Arizona, where I am originally from, and I love my job. I enjoy doing what I do every day. I specialize specifically in skin cancer surgery and removal of skin cancer using a specialized technique called Mohs surgery. Mohs surgery allows us to remove skin cancers, particularly off the head and neck. I trained at the University of Massachusetts when I was studying dermatology in my residency, and I learned about Mohs surgery. I fell in love with it. I fell in love with the fact that when a patient came to me and had those concerns and had skin cancer, that I could present to them a treatment that would offer them a 99% cure rate in most cases. And I spent a year of specialized training just in Mohs surgery, and during that year I did over 1,000 cases of Mohs surgery. And not only did we do the Mohs surgery, we would have to do the reconstructive surgery, or the plastic surgery as a lot of patients know it, to reconstruct or put the defect back together so that the scars would disappear and hide in natural contour lines, so that they don't have a scar that other people notice, so that they can live life without worrying about how they look. That's probably one of the things I enjoy most about my job, is the reconstruction. And we do probably 98% of the reconstructive surgery here in our clinic. It's all done under local anesthesia, so our patients are awake during the surgery. I'm talking to them, I'm having a conversation, which is something I enjoy. I get to know my patients while I'm doing the surgery. And it is a relaxed environment, one in which patients feel very little pain. During the surgery, they feel no pain. I have outstanding staff that work with me and do their part to help relax the patients as well. And most of the patients, when they get done, they say that was far better than I had ever anticipated it being. And I pride myself in being able to offer that to my patients and giving them the very best outcome that they can possibly receive. I absolutely love my job. I really do. But honestly, I love my life outside of medicine too. I have 7 children, a wonderful wife. Like I said, we moved here 7 years ago from Arizona. We live in the community where I work, and I love that. I love seeing my patients out and about when we're out in the community. I love Wisconsin. It's not Arizona, and my patients always tease me about that. Why would I move to Wisconsin from Arizona? We have loved it, including the 4 seasons, the outdoor sports, the hunting, the outdoor camping and balance that I can find that my job offers me between my love of work and my love of family. Those are the things that drive me. Those are the things that are the most important to me. Even though I've seen thousands of skin cancers, I understand that when a patient comes to me, this is probably their first experience with skin cancer. I take that seriously. So even though it's something that I'm used to and that I deal with every day, for them they come in and I understand that they're scared, that they don't know what to expect. You hear the word cancer, you hear the word surgery, and it's a scary proposition. My goal as a physician is I like to sit down with the patient. I usually come in and I sit down and we have a face-to-face talk about their diagnosis. I'll talk about the pathology. I'll answer the questions they have. I'll discuss what to expect during the surgery. I want them to be educated and then feel empowered. The days of the doctor making all the decisions and telling the patient what is best for them, I think are in the past. I think that the best thing that we can do as physicians is educate our patients, teach them, and then empower them to make good decisions about their health care so that they feel good at the end of the day that they made the right choice that is best for them. We are here for the patient. It's not the other way around. I exist to be able to help the patient get better, to be well, to be healthy, to get rid of that skin cancer. And I want them to come through this scary experience with a positive attitude, with a positive experience, to get done and say that was much better than I anticipated it, to leave my office with hope, knowing that they're not going to have a horrible scar, knowing that their cancer's gone, knowing that the problem they came into my office with is now behind them, and they can look forward to a brighter future that doesn't have skin cancer in it anymore. I always communicate to my patients that I'm here, that if you have problems, that you can come see me, that they can call and we can address those concerns over the phone. I'll often call my patients personally to give them their pathology results, because I think it's important that as often as possible that they talk to the doctor. So I believe in that personal touch. I believe in having that access to the doctor so that they can feel comfortable with who they're seeing and who's providing care and who's taking care of them. A big part of my job, believe it or not, is actually prevention. That I don't want people to get skin cancer, and I try to preach sunscreen. I try to preach prevention, sun avoidance, using wisdom out in the sun. But I see it that if you are one of the unfortunate people who does get skin cancer, that we can create a partnership to make sure that you get better. My name is Dr. Sean Pattee, and my promise is that we will provide the best care possible so that you get the best treatment for your skin cancer.